Hey PLABers, this is your PLAB partner with a few more questions to stimulate your thinking. Keep learning and improving, reduce confusion and gain clarity. Okay, a 27-year-old woman had a surgery to reverse her stoma. During the ward round, you find that she has only produced 110 milliliters of urine in the past 8 hours. Which electrolyte problem can be a serious complication of this condition? So this patient is in acute renal failure, whether that is because of any intra-abdominal obstruction or whether it is because of being underfilled like a pre-renal failure, but acute renal failure will give rise to hypercalcaemia, which can be life-threatening as it can cause arrhythmias and cardiac arrest. A 13-year-old boy presents with haematuria and acute abdominal pain. He was diagnosed with nephrotic syndrome 2 months ago and now has renal vein thrombosis. Why are patients with nephrotic syndrome at risk of venous thromboembolism? The answer is loss of antithrombin 3 into the urine due to the damage in tubules. Now, they are at risk of thrombosis because of more fibrinogen in their blood. Loss of protein C and loss of protein S will also contribute to the elevation of fibrinogen, but the reduced excretion of these proteins will not cause. A 24-year-old biker has been rescued after being trapped under rocks for almost 12 hours. He complains of reddish-brown urine. His creatinine is 350 unit moles per liter and his urea is 15 millimoles per liter. What is the most important step in this management? Patient needs IV normal saline. Because of trauma and muscle injury, he now has rhabdomyolysis and hence this color of urine, which is reddish brown. He needs hydration with normal saline, otherwise he will develop renal toxicity. A 46-year-old man has been diagnosed with adult polycystic kidney disease. He asks his GP if his 20-year-old son could be screened for the disease. What is the most appropriate screening test? Okay, and a non-invasive screening test would be ultrasound of the abdomen. Genetic testing is still not routinely offered, although there are certain gene changes associated with this condition. CT abdomen will not add more value as diagnostic criteria are fulfilled on ultrasound if there is at least 2 cysts on kidneys. Urine microscopy will not tell if someone has polycystic kidneys. Yes, it is always good to refresh the topics that you found tricky. Spend a few minutes reading around those topics that you know less about. Finally guys, leave a comment or press the like button to encourage us to upload more videos like these.